This patient was referred to me for endodontic treatment of tooth number 30. According to the patient, the crown is 1 year old. Recently, patient started to have symptoms. Went and saw her dentist. Her dentist took some radiographs and said there was nothing wrong with her tooth. Patient claims the following days, tooth started to hurt even more. She had some pain meds at home. She started taking the pain meds. No help. And by the second night, the pain, according to the patient, was so severe that her husband had to take her to the emergency room. And there she was given antibiotics and more pain medication and told that her tooth was abscessed. And referred back to her dentist. And from there, her dentist referred her to us for examination, evaluation. And as you can see here, periapical lucency here and here. Tooth responded necrotic to vitality test, percussion tender, palpation tender, probings 2 to 3 millimeters. So we discussed options with the patient, and the patient decided that she wanted to try to see if tooth could be saved. And that's what we did today. Today went through the crown and take a look. So you're thinking this tooth has probably 2 mesial canals and 1 distal canal, right? That's what you're thinking. Usually these teeth have 2 mesial canals and 1 distal canal. And also I want you to pay attention to what you see here. These are pulp stones. And here's the post-op. So take a look here. Look at all of this anatomy. 3 mesial canals, mesiobuccal, middle mesial, mesiolingual, 3 distal canals. 1, 2, 3. Look at all of this anatomy that we were able to also pick up. Look at all these laterals. Look at all of these laterals here. Look at the anastomosis here. So if you just looked for 3, you would have found 3 and you would have been done. And the root canal would have likely failed because you would have left necrotic tissue and bacteria behind. So that's why it's important to be able to know and see what you're doing and then do it properly. And then this tooth has a chance. Still, the success rate for this root canal is not 100%. But at least we did everything correctly. And now the rest is up to our body, and we'll hopefully follow up with the patient. Patient will come back to see us in a few months for a post-op check, and then hopefully we'll have success. Although, again, as I always say here, and then as I always tell my patients, I can't give you a 100% success rate. There is no such thing, especially when we're dealing with microorganisms and their byproducts. But here it is, 6 canals, 3 on the mesial and 3 on the distal. And this is another angulation. Again, you can see the 3 mesial canals, 3 distal canals, and look at all of these laterals that we were able to pick up, and anastomosis between the canals.